Lab activity number 2, instrument grasp, instrument design, and classification. You will need your Neil Gehrig book as well as your lab activity to follow along with this video. Let's start out with identifying the parts of the periodontal instrument. Each instrument will have a handle, shank, and 1 or 2 working ends. So let's take a look first at your periodontal probe. Here is the handle, here is the shank, and here's the working end. Let's look at another instrument. This is your anterior scaler. It is called the 6-7. Here we have the handle. There are 2 shanks and there are 2 working ends. Now that you know the parts of your instrument, let's talk about proper grasp. We will always use the modified pen grasp. Let me show you how this is done. If you would like to follow along on page 75 of your book, it will tell you the exact places of your fingers and your hand that the instrument should be touching. Okay, so your thumb and your index finger are what we're going to focus on first. You'll rest the pads opposite of each other, almost right where the shank meets the handle, okay? The fingers don't overlap, meaning they don't go like this or like this. There's a tiny space between them and they're on opposite sides of the handle. The fingers are held in a relaxed manner. If your fingers are blanched, you're holding too tightly. Let me show you what that looks like without a glove. If we can see your fingers blanching as we're practicing this in clinic, you're holding it too tight. You really should be very relaxed as you hold your instrument. The instrument handle should rest anywhere between the 2nd and the 3rd knuckles. Anywhere here. Up here is unacceptable. Down here is also unacceptable. Anywhere between these 2 knuckles. Let's now talk about your middle finger. I'm going to talk about this side of the finger and this side. So the most inside of your finger, the pad of that, should be resting against the other side of your pointer finger, and it will be resting on the shank. Okay? The other side, your fulcrum finger is going to touch the other side. So let's get this all together. Perfect. It should be resting on the side of the instrument. Okay? Then your ring finger, which is your fulcrum finger, helps balance and support your hand and the instrument when you're working on a tooth, okay? Do you see how everything, once it's all set up, they function all together? And then your ring finger, it can just kind of hang out there. It doesn't really have a function, just kind of relax it, let it rest where it's at, okay? So let's get all set up, and your grasp will look like this. There are a series of pictures in your book that show incorrect grasp, things that you can do if you are double jointed. So take a look at those pictures. As clinical instructors, we will be very strict on your grasp. Improper grasp can make it so that you have hand injuries, you get tired, it will burn you out. It is so vital that you practice the grasp. For those of you who are left-handed, it is the same thing. You're going to have your pointer and your thumb opposite one another. You're going to have your middle finger, rest on the shank, and then your fulcrum will also just be on the other side of that middle finger. Okay, so lefties, that's what it looks like. As you start performing your dental hygiene procedures, you might find that your hands do get sore, they get tired, they're not used to it. Please refer to your book. There are wonderful exercises that you can do. And then even when you get out into private practice, these are great to do in between patients while you are waiting for a patient, when you get out into private practice as well. So take a look at those exercises, practice them. I suggest using them. This book is a great resource for you. Let's now look at the design characteristics of an instrument handle. We've already talked about the handle, which would be here, the shank, the working end, on this side, the shank, and the working end. Let's talk a little bit more about the design. Let me zoom this in a little bit. So when you're looking at your instrument, this is the Barnhart 5.6. The 5 is on this side, the 6 is on this side. The 6 side would be here, and the 5 side would be here. If the numbers were vertical, not horizontal, and the 5 was on this side and the 6 was on this side, the 5 would be on the top and the 6 would be on the bottom, okay? Let's talk about the width of handles for a minute. The wider or the thicker the handle, the more ergonomic and easier it will be for your body. I don't have a difference in specific handles, but if you look the difference between these 3 pens, it's going to be a lot less work for my fingers to be holding a fat instrument than a very skinny instrument, okay? So when you go out into private practice and you get to choose what instruments, don't buy the thinnest handle, buy a thicker handle. Better for you in the long run, I promise. Let's now talk about simple and complex shank designs. So I have my 6-7 right here. When we talk about simple shanks, we're talking about it only bending in one plane. And a simple shank is typically going to be for anterior instruments only. So when I look at this, you can see how the instrument is only on one plane. It doesn't have a bunch of curves. It just stays on the one plane, okay? Not a lot of bends. That is a simple shank. Now, when we look at this instrument, this is your Nevi, okay? Now you can see that it doesn't just shoot off in one plane. Now we have 2 planes. That is a complex shank. Complex shanks are typically for posterior instruments, okay? So let's get your 204. This is your 204S. This is your 204S, and you can see it definitely goes on to more than one plane, if not multiple, with all of the different bends. So your 204S is also a complex instrument, and it is for posteriors. This is your Barnhart, your 5-6. As you can tell, multiple bends in the instrument where we are going on to more than one plane. You can see all the different bends of the instrument. This is also a complex shank. Let's now talk about your functional shank versus your lower or terminal shank. So on this instrument, this whole portion of the shank is the functional shank, okay? Now when we talk about the lower or the terminal shank, that is this right here, okay? It's the part of the shank right before you get to the working end, okay? So this part right here is the lower or terminal shank. This whole portion would be the functional shank, okay? Right before we get to our working end. Now you might be asking yourself, why is it important to know where the lower or terminal shank is? It's a visual cue of making sure that you're adapted to the tooth and that you have the correct working end. Let's talk about the working end of an instrument. So you turn the instrument towards you. This is the face of the instrument right here. When we turn the instrument to the side, that is the lateral edge. Where the face and the lateral edge meet together, that forms your cutting edge. Right on this side. So the face, the lateral side, and the point where those two meet is the lateral edge. Where the face and the lateral edge meet is your cutting edge. Refer to page 204 to see this better illustrated close up. Let's talk tip versus toe. This instrument is your 5-6, and you can see how it has a rounded edge versus this instrument when you look at it. Or when you look at this instrument, it comes to a tip. So this is a tip, and this is a toe, the rounded edge. This instrument has a tip, it comes to a pointed edge, and This instrument has a toe. You can see how it rounds. This toe goes subgingivally, and the tip stays supragingivally, meaning above the gums. Let's put everything that we learned together. Let's identify the instruments according to that table. Now, when we look at this instrument, this is your H67. Does this have a simple or a complex shank? Meaning, is it just one plane, or is it curving onto more than one plane? One, correct. So it's a simple shank. Now, does it have a tip or a toe? It points, so it comes to a tip, meaning it's a short shank. If we know that it's a short shank and it is simple, that means it's an anterior instrument. And if it has a tip and it's anterior, that means we're going to be staying above the gums, meaning supra, because tips don't go below the gums. And we use this to remove calculus. Okay, let's go on to your next one. Your Nevy or your Montana Jack, okay? Is this a simple or a complex? It's complex because it flows onto a different plane. It doesn't just stay on one plane, we go to a different plane. So it's complex. Does it have a tip or a toe? It has a tip, so that means it's a short shank. Now, if we know that it is complex, we know it has to be a posterior instrument. And if it has the tip, that means, are we going above the gums or below? So supra or sub? If it's a tip, we're staying supra. And this is also a calculus removal instrument. Okay, next, let's go on to your Barnhart. So your 5-6, okay, is this simple or complex? Complex, very good. Now let's look at this one. This has a toe. It has that rounded cutting edge, okay? So that means it's a long shank. And we know that if there's multiple bends, it's going to be a posterior instrument. And then we know if it has a toe, it's allowed to do what? It's allowed to go subgingivally, so below the gums. And this is also a calculus removal instrument. Okay, let's do your last calculus removal instrument. This is your 204S. Does it have a simple or a complex shank? Right, complex because of the bends on the instrument, right? Let's look. Does it have a tip or a toe? That comes to a point, so it has a tip, which means it is a short shank. Does that mean it can go supra or sub? If it's a tip, it's going to remain supra, above the gums. And then because of all the bends in our instrument, because we know it's complex, it's going to be a posterior calculus removal instrument. Very good. I hope this has helped you. Please ask questions with your CI in clinic today and really read through the book. It breaks things down and makes everything so simple. Thank you so much. Bye.